As we have navigated through the pandemic, every decision that has been made and will be made centers on one common goal: keeping each other, our families, and our communities safe from COVID-19. On August 5, Kettering Health, following the recommendation of the Ohio Hospital Association, numerous professional medical organizations, and along with more than 1,500 hospitals across the nation, announced that staff members and providers would be required to receive the COVID-19 vaccine. In making this decision, I also want to reaffirm our steadfast commitment to our values: caring, competent, trustworthy, innovative, and perhaps most important, collaborative. Difficult decisions are met with a variety of strong feelings in all directions, and the vaccine requirement has been no exception. As we've rolled out this plan, we remain steadfast to our commitment to engage, listen, and evaluate as the situation evolves. I want to thank each of you who have had productive conversations with your leaders, participated in one of our town halls, or shared feedback through our incident command email inbox. These discussions remind us of two things. First, we have a dedicated workforce that cares deeply about our mission and providing high quality, Christ-centered care to those we serve. Second, in the same way that we've adjusted throughout this pandemic, it is vital that we continue to evaluate the ever-changing landscape and adapt accordingly. With that in mind, we made a few updates to our policy, including the deadline to receive the final dose of the COVID-19 vaccine, which has been moved back 2 months to December 1. The deadline for medical and religious exemption requests, which has been pushed back to October 15. We adjusted the medical exemption requests for a variety of conditions, including previous COVID-19 infections, those who are trying to conceive, are pregnant, or breastfeeding. These updates represent the importance of ongoing, two-way dialogue as we continue to support each other and those we serve. As the pandemic continues to evolve, we will adapt our approach and our policies to protect our team members and our community. For more details about the new requirements and the latest on our response to the pandemic, visit the dedicated COVID-19 page, which continues to be updated regularly. Across our nation, state, and region, we are seeing a dramatic rise in COVID-19 cases. And as our own patient volume climbs, we remain steadfast in our commitment to putting the safety of you, our own people, as well as our patients first. Since the beginning of the pandemic, our mantra has been simple: together, supporting each other. The COVID-19 pandemic has presented a challenge unlike any we've faced before, and I'm grateful for your relentless efforts to provide high-quality care and your dedication to working together, bringing your best each day in service of each other and our communities. Over the past few weeks, I've been pondering how the early Christian church, as described in Acts, lived this message so beautifully. All the believers were one in heart and mind. No one claimed that any of their possessions was their own, but they shared everything they had, and God's grace was so powerfully at work in them all. This past week has been a great reminder that even as things continue to change, there's one thing that remains constant. We as colleagues, caregivers, and citizens are united in the fight against this pandemic. Thank you for your tireless service and unwavering commitment. I continue to pray for each of you and ask that you do the same for me, our leaders, and each other.